the right to live independently and be included in the community is Article 19 of the Convention. During the negotiations of the Convention, there was a clear mandate to address the issue of people who continue to live in institutions. And again, New Zealand was one of the few jurisdictions that was able to say that they had addressed this issue and that there were no large residential institutions in New Zealand. And so New Zealand was a resource in terms of thinking about how we conceive of the right to live and be included in the community. For Inclusion International, this is really one of the fundamentally important rights for people with intellectual disabilities, because they were among the groups most likely to have been institutionalized around the world. But the notion of living independently and being in the community are quite a lot more than where we live physically. And so in the negotiations, we tried to articulate several aspects of that right. And I'll go through not the exact wording of the article, but the three elements that are in the article. Inclusion International, for the purpose of trying to have state parties understand that Article 19 means a lot more than physically where people live, decided that we needed to create some attention to this article, and that our strategy, as it has been with other priority areas, was to raise up the voices of people with intellectual disabilities and their families around the world. So the purpose of our campaign, which has been over the past 2 years on this issue, was to ensure that the perspective of people who themselves have an intellectual disability was what was going to define the vision of what being included is. And that we would also understand that people live in context. People don't live in a vacuum. They don't live alone. They live with their families or in communities with other people. And so understanding that was really fundamental, and I think an important objective of raising awareness about the view of what it means to live and be included in the community. We also, of course, want to raise awareness about the exclusion and isolation that people face and continue to face. So the reality of what people's lives look like, whether they live in an institution or they're living in the community but continue to be isolated and excluded. And we wanted to be able to identify what some of the key elements. How would we know if we were successful? How do you know if we've actually achieved Article 19? What would it look like? And we wanted to talk about some of the strategies that have been used for change. What was the process in New Zealand for moving people out of institutions, and in other countries like New Zealand where institutions have been closed? Likewise, in places like Africa where institutions might not have ever been built, what does it look like to build communities that are inclusive and supportive of people's participation? So we developed a process to talk to our members around the world, to talk to families. We had focus groups, we had stories, we had opportunities for people to come together at regional forums. And over the course of 2 years, we have over 95 countries that have contributed to our global report, which will be released, as I mentioned, in Washington. So Article 19 does more than establish a right. It also provides a framework for looking at what it means to live and be included in the community. It was negotiated and designed by people with intellectual disabilities and with input from families. It's a tool for us in our countries and in communities to work with governments, lawmakers, and other stakeholders. There are 3 parts to Article 19. The first is about choice. The first section is about choice. Persons with disabilities have the opportunity to choose their place of residence and where and with whom they live on an equal basis with others. Oh dear, I just turned off the whole thing, sorry. And that means having an opportunity and having opportunities and options, understanding decision making, empowerment, supports to make decisions, and innovation. And I'll come back to the results on that in a moment. The second part of Article 19 is about support. People have the right to access a range of supports to live and be included in the community. I keep pressing the wrong one, I apologize. But supports actually, there are two aspects of that in terms of our consultation with people and the reality in their lives. The first is to individuals. Individuals need supports. They need particular kinds of things like attendant care, employment support, disability-specific services. They might need income support, disability benefits, or tax credits. They might need personal support that's informal from their family member, from friends, from community, from teachers. But there's a second kind of support, which is really not talked about when people think about the right to live in the community, and that's support to families. Families need support in planning and information. They need support in compensation for lost income because they're in a caregiving role. And they need some respite, they need some breaks, they need some time where they're not fully responsible for the caregiving in the home. And the third part of Article 19 is really the foundational piece. It's about inclusion. And it says that community services and facilities for the general population are available on an equal basis to persons with disabilities and are responsive to their needs. And so that means we need systems in our communities like inclusive education, education opportunities and support, access to health care, transportation, recreation, and community organizations. So our key findings from the report, and these probably won't be a surprise to many of you if you've looked at what it means to live and be included in the community. These things are not going to be hugely surprising to many of you, but I think there are implications for our actions at a policy level and for our actions as family organizations. The first is that people with intellectual disabilities have no voice or control in the decisions about where and with whom they live. And so as Patricia was saying, the right to choose what your life looks like is denied to the majority of people with intellectual disabilities wherever they live in the world. And this is fundamental, and this is really where you have to read the convention, as Roger suggested, as a whole document. You can't look at education by itself or Article 12 by itself, and certainly Article 19 is a place where all of the aspects of the convention really come into play. Also, that the vast majority of adults with intellectual disabilities live at home with their families, whether they live in New Zealand or in the UK or in Africa or Latin America or in a small country in Asia Pacific. The reality is that the majority of adults with intellectual disabilities live at home with their families. Institutions continue to be a major human rights violation, and there's evidence in some regions that the admission of children into institutions is increasing, and that new forms of institutions are being created. We've seen in a lot of countries the introduction of new words to describe euphemisms, as I would call them, for institutions. So we now have gated communities in the United States for people with intellectual disabilities. We have centers of excellence. We have training centers. We have, the list goes on and on and on, and we had a little bit of fun in the global report, which you'll see when we release it, listing all of the different names that people have now given to institutions, and a little bit tongue-in-cheek, but very seriously, the propensity to return to the idea of institutions continues to be a threat around the world, and in some places is a threat that new institutions will be built in places where they never existed before. I think that the attention of the convention, a lot of governments feel like they need to act and do something, and so in places where, for example, the World Bank is investing a huge amount of money, there is some appetite for, well, we have to do something for these people. What should we do? Let's build a building. And so I think there's a real threat there, and we have to take those threats very seriously. The major source of support and care which people receive is from their families. But families, in turn, receive little or no support from communities or from their governments. Even when people with intellectual disabilities live in the community, they're often isolated and excluded from the community. And that is true whether they're living in a resource-rich country a low income country. We've seen that people, even in places where we have large service infrastructure, sometimes as a result of the way that service gets delivered, people live very isolated lives. In places where there are no services, people live isolated lives and excluded from the community for other reasons and have a different experience, but the experience of being excluded remains the same. One of the key things that we found in places where large institutions have been closed, but yet there is a service infrastructure, is that disability services continue to be a segregated institutional approach. So while we moved people out of institutions, we didn't change the way we think about supporting them. And I think that's one of the key things that we have to examine when we begin to think about transforming how we support people to live in the community. So the implications for public policy are important. We have to look at the convention as a tool for helping governments think about how they deliver public policy. But there's also a responsibility of other stakeholders in the community. And as family organizations, we also have a responsibility to think about the kind of work we do and where we place our efforts and energies. And so I'll just give you sort of a few sort of directional implications. Around the issue of choice, it's clear that we need policy and legislative reform. We need to obviously deal with the issues of guardianship and develop systems of supported decision-making. But I think Patricia's comments about what I heard Patricia talking about was the need for societal change, a need for a complete rethinking about how we treat and respect people with intellectual disabilities and understand fundamentally, unconditionally, their right to make decisions. And what Inclusion International has been involved in a number of places is innovative projects around supported decision-making to develop models of support. And it is a bit of a chicken and egg scenario. Changing the legislation to say we are moving from substitute decision-making to supported decision-making is only one part of the equation. We can change the legislation, but if the way that we behave doesn't change, then the legislation will be useless. And I think really fundamentally what has to change is the way we work in community to support people in their decision-making. And so those things have to go hand in hand, and family organizations in particular have a really large role to play in thinking about what supported decision-making looks like. And for families, that can be a very difficult thing. It's very difficult to understand in many cultures that families aren't in positions to make decisions for their family member, but rather to be supporting their family member and understanding what their own intentions are. We also have to think about, in the issue of choice, one of the things that emerged from the report was people talking about the only thing they can have is what's being supplied. And governments tend to focus on the supply side of the equation. They don't support the demand side of the equation. And so we need to think about, and what I mean by that is, here are the 5 things you can choose from because that's what governments fund. We need another balance. We need some ability for people to have power in their lives so that they can take the supports they want and make choices that might fall outside of those 5 options. That public policy discussion is going to look different in every country and in every context. But I think clearly the messaging from all over the world that we had in the report was we need to find a way to balance so that there's an accountability to supply side because the demand side is asking for different things. And so we need to find ways to support individuals to be able to choose what they want, not just to have limited options available to them. And you know, the key phrase in the convention is on an equal basis with others. So if your 20-year-old university-age family member is able to choose to live in a residence or to go and live with roommates, people with intellectual disabilities should have similar kinds of options. The second, around the issue of support, one of the clear messages coming out of the report, both from self-advocates and from families, was that we need to rethink the way that families are supported in our society. do we have family-friendly public policy? Can a parent go to work? Are there provisions so that the parent can continue to support, parents and families can continue to have a family member live at home as a child or as an adult, but that they're able to function as families and be strong as families so that they can be supportive of their family member in the community. And I think that we have to be very careful within the disability and family movements to acknowledge that we should not be put in a position of having to choose between supports to the individual and supports to families. This is not, we cannot be forced into making a choice between whether families should get support or individuals should get support. Those are unique and different kinds of support, and one does not replace the other. In the current economic situation in most parts of the world, we're under increased pressures. Families are under increased pressure to provide more and get less. If we allow ourselves to be pulled apart within the disability community and start to have a debate about whether support should go to individuals or to families, we're going to become less able to advance the goals of Article 19. And then finally, and most importantly, what we understood from the consultations with people around the world was whatever supports, formal service or other kinds of supports that a person has in their life, unless our communities are organized in inclusive ways, there's no amount of service or support that will help us to achieve Article 19. Supports are obviously necessary, and they are clearly not a priority in most countries. Finding the right kind of support continues to be a battle wherever people live in the world. But unless our education systems, our employment systems, our transportation systems, our healthcare systems are built in ways that are inclusive from the outset, there's no amount of support to the individual or the family, no amount of choice that we give people that's going to really mean that they're included and part of our communities. And this is really, I think, an important thing to think about in terms of our roles as change makers in our communities. We spend a lot of time in the disability community focusing on specific services, budgets, things that we need to get that are disability specific. We spend much less time thinking about the larger challenges in our communities. Roger, I think, really clearly identified that within the education context. There's a large discussion happening about what our education systems should look like, not just in New Zealand, around the world. And if we're not part of that discussion, if we're not investing in that discussion as family-based organizations and DPOs, we're not going to achieve our goals. We're going to continue to be put in a silo, and the issue of disability becomes the add-on. So you have this education system, these are the objectives, let's add on a piece for kids with disabilities. Likewise in health. If we're not thinking broadly about supporting all people to access healthcare in our communities, we're going to end up with a healthcare system and then silos for different kinds of groups within it. So I think one of the key things, and I think you may be the first audience to hear this, the title of our report is going to be Inclusive Communities Equal Stronger Communities. And I think the fundamental message of our report, aside from the detailed stories of how people are excluded and where they live and some of the statistics that will come out of it, are really about how we focus our efforts going forward, focusing our efforts on the broader systems that are impacting on people's lives, giving attention and human resources to our advocacy that is about making sure we organize our societies in ways that are inclusive. So that's your sneak peek of the conclusions of the global report. This is the first Ralph has heard of them, so we'll have to wait and see. I should mention that we were able to have contributions from every part of the world, and we're very proud that we have over 90 countries that have contributed either stories or surveys, videos, all those kinds of things. And you can see some of those contributions on our website, and the global report will be released at the end of October in Washington and will be available on our website. I hope that it provides a tool for people's work in their own countries. It provides clearly a tool that Inclusion International will be able to use in advancing our work around Article 19 in the UN system and with governments at national levels. So thank you very much, and I look forward to our discussions this afternoon.